how can we help? That's always the $1,000 question, frankly, the most important thing that most of you all probably care about. And it's really a three-pronged approach, like it is with just about every condition that we get in here. We start with rehab exercises first. So using the McKenzie method, if it is a carpal tunnel syndrome that isn't already to the level that needs a surgical consult, what we're typically going to find is that the carpal tunnel syndromes, we actually need to put some slack onto that median nerve passing through the tunnel. And so typically a traction move with some flexion is going to actually really open up that space, get tension off the nerve, and actually help people feel the best. Now, that's not a guarantee that that's the move, but when we do the assessment, that is frequently the directional preference that we discover using our McKenzie method. And then in time, there needs to be some more strength and stability that needs to be put across the hand and across the wrist. So doing things with resistance bands, doing negative intervals with light weights, actually getting somebody a little bit of like the occupational therapy putty to really actually work through that hand and those finger movements while keeping that wrist in neutral. Those are all great strengthening concepts that we tap into in times with our carpal tunnel syndromes. In the here right now, though, what we're able to do in office besides progress exercises is we do stuff with the muscle therapy. So it's really great to help the patient actually get what we call hand reposition. So opposition is when the hand narrows in close, and reposition is when the thumb goes as far away from the fingers as possible. So helping that patient to really open up that hand and wrist to get blood flow to the tissues, reset the neurological mishaps that are going on in there to get some pain relief and improve the function. A lot of wrist work as well too. So we'll usually go up and do a lot of work into like the extensor part of the wrist and work into the flexor column as well too, to just further take some load off of that carpal tunnel. And being chiropractors, we like to adjust when indicated. So like I said, we typically take what we found as the McKenzie directional preference and set up an adjustment or a heavy mobilization that goes right in line with that treatment at the hand and at the wrist, helping the patient to get deeper into all of those movements. And then frequently, it's not a half bad idea to just work our way up the chain and realize the median nerve, its origin is coming from the cervical spine. So taking some time to really open up the neck, whether that's a traditional manipulation or if we decide let's do some like traction and mobilizing there. But either way, trying to remove any of the perturbations or blocks that are existing in the neck that could, even if it's just 10% of undue influence at the wrist, we want to remove that if we can. And by the same token and logic, improving the function at the upper thoracic spine should at least pay small dividends back down at the wrist. So again, the approach being rehab first, and then what we do in office that the patient can't do for themselves at home is the muscle work and the chiropractic mobilization or manipulation therapy.